So my name is Peter Burns. I'm a professor of medical biophysics at the University of Toronto, and my laboratory is involved in developing the imaging methods that are used for microbubble contrast agents. So many people, when bubbles first became available, had the idea that they were somehow in competition with the instrumentation, that if you used ultrasound well, or if you had a very good ultrasound machine, you could measure blood flow at the perfusion level in an organ or in a tumor or in the heart. And now I think in the last 10 to 20 years it's become incontrovertible and widely accepted that microbubbles don't compete with conventional ultrasound technology, they add to it. Without microbubbles you can't measure perfusion using the Doppler method, but if you add microbubbles to the Doppler method, you can produce images which are completely new for ultrasound, images that will show the tissue and will show the perfusion of the tissue separately and in a way that can be quantified in real time, without using radiation, without using potentially nephrotoxic injections. And I think that everywhere in the world this has become recognized in more than 60 countries in which microbubbles have been approved. They're now routinely used in a whole range of applications, from in the heart, in cardiology, in the solid organs of the abdomen, and some of the hollow organs of the abdomen, such as the gut, in radiology, and increasingly in cancer, in oncology, both in diagnosing, characterizing cancers, but also in monitoring the response of cancers to specific targeted therapies whose aim is to affect the blood supply to a cancer. And all of this with a real-time, widely available modality that's portable and can be taken to the bedside even of very sick patients. It is irreplaceable.
Do you consider it safe?
Yes, I think that most of us are convinced that ultrasound contrast agents are safe. We know that, like any agent that you inject into the peripheral venous system, there is a risk of an anaphylactoid type reaction. That risk, 1 in 7 to 10,000, has been documented to be roughly equivalent to the risk of injecting an analgesic or an antibiotic. Other risks involved with microbubbles potentially are its interaction with ultrasound at very high ultrasound intensities. I don't think that these are a real risk in diagnostic ultrasound, and I think that we're in the process of seeing how some of these interactions with higher intensity ultrasound can be parlayed into advantages for ultrasound therapy, for example, high intensity focused ultrasound that's used in ablative therapy in cancer.